Our organization celebrated its 140th anniversary just 2 weeks ago. And I'm reminded that in the last 140 years of our organization's history, we have weathered previous pandemics. We've weathered multiple world wars and other times of crisis. And we will get through this crisis, and we will be prepared to serve the children and the families that will need us as we go into the future. I want to thank you for everything that you have done to support us during this terrible time of crisis. We could not have done what we are doing without your significant support. As we begin to discuss how we will reopen our organization to full ability to provide our services, we're doing so through the lens of being compliant to what our governor is asking us to do and what the federal officials are asking us to do. But we're also doing it because we want to make sure that we are protecting the lives of our residents and our clients, and of course our team members. So over the last 2 months, we have continued to provide around-the-clock 24/7 care to the children that need us in our COSAIR Charities Pediatric Convalescence Center. We've also been providing care to the children in out-of-home care that reside in our residential treatment program. Many of our services were suspended in order to minimize risk to our team members that remained on campus and to our other programs. And a great majority of our team members still came on campus to provide that care to our residents, but where we were able to do so, we did transition a good number of our team members to working from home remotely. So as we go about our reopening, we know that it will be much slower and much more detailed than our quick decision to suspend or close programs. And so as we go about this work, we're going to do it through a very precise evaluation process that is going to make sure that we're taking the most cautious path possible, and we're also protecting the safety of everybody that is involved. So at Open Arms Children's Health, which is the outpatient medical home part of our organization, our medical center has remained open for the last 2 months, continuing to provide care to the children of our community. In our dental and audiology areas, we have provided emergency services, and many of our other services transitioned to utilizing telehealth. This week, we were excited to begin to slowly reopen some additional services at Open Arms Children's Health. Our audiologist began providing brainstem testing and newborn screening. And in the next couple of weeks, we will begin to expand additional services that will reopen to the public. But everything that we're doing there in this outpatient setting, we're doing through a lens of safety, making sure that all of our patients are coming in and being screened, they're being universally masked, we are doing staggered appointments, and we are making sure to honor social distancing in our waiting rooms as well. For our behavioral health services, our parenting classes were transitioned this week using a virtual telecommunications environment. Our Safe Exchange parent exchange program is in the process of being evaluated, and we hope to be able to reopen that soon as it's safe to do so. Unfortunately, we are still unable to welcome visitors back onto our campus in order to minimize the risk and the spread of the illness to our team members that are still here and to the residents that are still so very dependent on the care that we provide to them. So we have been so very proud for the last 2 months to continue to serve our community during this time of crisis. And your support, your significant support, has been vital in our ability to provide that care. And as we go forward, we know that we need to be prepared to serve the children and the families that are going to need us tomorrow. So everything that we are doing right now, our precautions, our planning, our reopening, is being done with the children and the families in mind, and the safety of our team members, so that we can be here to continue to be the heart of our city for many more years to come. Thank you so very much for everything that you do to support our mission.